Good morning. Today we will talk about 3 chronic diseases and exactly how they impact your health, what you can do about them to lessen the severity if you have them or prevent them in general. I will start with some housekeeping and say, despite me being a nurse practitioner, this is not a substitute for medical advice from your doctor. You should not start, stop, or make any medical changes without consulting them because I can give you general information, but I don't know specifically what your health situation is, so to speak. So let's start with the deadly triad and exactly what is this? This is high blood pressure, high cholesterol, and diabetes. These 3 diseases separately or together can have a dangerous impact on your health, and they can put adults, especially those 65 and older, at risk for heart attacks, strokes, and premature death. So what is high cholesterol? This is a fatty, waxy-like substance in your blood. Yes, the body needs some cholesterol, which is why we have LDL and HDL, your good and your bad cholesterol. But like anything else, we need balance. I'm sure we have all heard of these terms, but what exactly are they and how do they affect your body? Also, what is the impact on your health when you hear the words your cholesterol is high? So good cholesterol has a few different jobs. Number 1, it is like a filter and removes the excess cholesterol. Removing that excess cholesterol helps prevent plaque buildup. And we're going to get a little bit more in depth into plaque buildup because I really want this point to hit home today. I want you to remember this and it to leave an impact if nothing else does, so you have an understanding of this concept and how it affects your body. So HDL removes the plaque buildup in the arteries, and when we remove that plaque buildup, we reduce the risk of heart disease, which is something most of us really want to prevent. Now, LDL is your bad cholesterol. And again, when we say bad, you do need some of this, but there's a level. Just like anything else, like I've said before in life, we need balance. And we need a balance of these 2 things to keep our bodies in a healthy state. Levels of LDL increase the likelihood of heart attacks and strokes because think about the fact that they harden and narrow arteries, and that the artery that it's affecting is no longer an efficient pump for blood to pass through. So we're going to go into this next slide, which I feel gives a great visual of what these things are and how they impact your health physiologically. You can see that this is an artery or vessel, so to speak. When you see this yellow material here, that's plaque. And this is physiologically what's actually happening in those arteries. They're getting hard and narrow so that the blood can no longer pass through effectively. Now, data says that some of us can have cholesterol that is related to genetics, but it is a very, very small percent of the population that no matter what you do, you're going to have this genetic high cholesterol. I've seen it very, very few times in my career where patients have this genetic high cholesterol, so to speak, but the majority of the time people lean on the other side where it's due to preventable health choices that we can control.